Well, people are trendsetters, and there's no question about it. The U.S. First Lady Michelle Obama certainly is. The latest thing, though, is that her toned arms are pumping a new trend in plastic surgery. The American Society of Plastic Surgeons reports a huge increase in demand for upper arm lifts. Now, the procedure is also becoming popular here in Canada. Did you know that? Joining me now from our Toronto studio, Dr. Marc DuPéré. He is a plastic surgeon at the Visage Clinic. Hi, doctor.
Good afternoon.
So, what happened to good old-fashioned exercise?
Well, it's still very important to go through the diet, good exercises to tone up the biceps and the triceps. But for a lot of people, this is not enough. And as you've implied, there's been an increase in body lifts, in arm lifts, in a lot of the lifting procedures over the last 10 to 15 years. Obesity has been a problem, and I think people are recognizing the issues now, both in the US and in Canada. And this has led to people wanting to get healthier and more athletic. This is also in combination with the new procedures for stomach reduction procedures. Those procedures now are simpler and safer. Many of them are done with laparoscopic, that is the little camera. And this has led to a lot of people undergoing massive weight loss and resulting body parts sagginess.
So number one, you do this when people have gone through a huge weight loss, as you say, but once the procedure is done, they're in a better position to begin exercising and toning up on their own. Is that correct?
This is correct. With any of our procedures, especially for body procedures, physical activity and proper nutrition is always, always important.
And how often are you doing this in Canada?
Well, practically about 10 years ago, 12 years ago when I started my practice in downtown Toronto, I was doing maybe 5 to 8 a year. And now I look back at my records and we do between 25 and 50 brachioplasty or arm lifts a year.
Okay. And who's asking for it? What kind of people want it?
70% of my patients downtown will be post-massive weight loss. So those are the patients who've lost 100 pounds, 150 pounds, 200 pounds, and they will have significant sagginess under the arms. The other 30% are people who are just either because of genetics or because of lack of physical activity and toning exercises. They do want to get that extra 5 to 10% tightening on the upper arm. And for those people, we'll do a mini arm lift where the scar is hidden in the underarm area.
Okay, and this requires local anesthesia, I take it, and then leaves a small scar.
Yeah, for the mini arm lift, often is done under local anesthesia. We like to offer an intravenous sedation, which is a twilight sedation like the dentists do. Makes the procedure a little bit easier and more pleasant for the patient, as opposed to the longer brachioplasty for the massive weight loss patient. The incision is from the underarm area all the way to the elbow, and that requires a general anesthetic.
We know that plastic surgery, cosmetic surgery, comes at a cost. So how much would this cost?
It depends, again, on the type of anesthesia and the length of the procedure, but on average, the mini arm lift or mini brachioplasty will cost around $4,000, whereas the full brachioplasty will be closer to $7,500.
Okay, Dr. Marc DuPéré, thank you so much.
My pleasure.